Across the NHS, dermatology pressure isn't coming from one place, it's building upstream, where diagnostic uncertainty drives referrals. Most skin lesions seen in primary care are benign, but when confidence is low, the safest option is referral. And those referrals compound downstream pressure year after year. DermCAP addresses this problem at its source. It does so with a clearly governed framework, with defined safety thresholds, supervision, audit, and a simple rule: if in doubt, refer it out. We embed safe, governed dermoscopy capability directly into general practice through a structured 13-month clinical apprenticeship, not a short course. Clinicians develop pattern recognition, supervised decision making, and robust safety habits that persist long after the programme ends. For ICBs, this means fewer avoidable referrals, not by suppressing demand, but by improving decision quality at the first clinical contact, alongside improved appropriateness of 2-week wait pathways and a permanent upstream capacity that compounds over time. DermCAP isn't about replacing specialist care, it's about protecting it by making primary care safer, calmer and more confident. If you're looking for sustainable dermatology capacity rather than repeated downstream fixes, DermCAP offers a practical, low-risk way to build it.